بلاد المداد يا الله اسقينا بالمداد يا الله.
If you're smart and poor, being smart is not good enough. The being poor takes over. If you're rich and dumb, just hang in there. It'll come good.
Those objectives are listed in order of priority, and the first objective is giving every child the best start in life.
As a parent now, I have the opportunity to say, I'm gonna teach you about India. Let me teach you what there is that needs to be taught about, this colonialism and imperial, this period of imperialism. We can talk about left, we can talk about right, we can talk about Labour, Conservative, whoever. But ultimately, what are we doing within our communities? Because otherwise, we're just constantly blaming someone else. And actually, hold on. Like, how many times do you need to tell people, look, you can't have jalebi for breakfast? Like, that's just not a thing. You shouldn't be doing that.
Surround your children with really, really good role models. This is really, really important.
Assalamu alaikum to our guests today. We will be, inshallah, talking about social inequality today. I think it's a topic that is definitely on everyone's lips at the moment, in particular with what's happening with global events. So I just want to get the guests to introduce themselves. So Iblal, do you want to start top right?
Yep, Assalamu alaikum. My name is Iblal. I am a pharmacist by profession. I am very passionate about public health and inequalities in health, and I've been lucky enough to study a few lectures under Professor Michael Marmot, who really made me think about these issues in a different way. So today, inshallah, we'll be able to talk about these more in depth. But that's me.
Jazakallah khair. And so Bilal, who is, and again, I'm sure many of the people listening and watching will recognize our two guests as well, but just to introduce yourselves as well. So Bilal.
Assalamu alaikum. I'm Bilal Aziz. I am a primary school teacher. So I'm a curriculum lead at my local school in Aylesbury, actually, I work. I'm also a Key Stage 1 specialist, training other people to become teachers in Bucks as well. And with Karima, I'm the youth initiatives lead as well. So leading on a lot of the youth initiatives, such as the youth club and other stuff as well.
MashaAllah. And head teacher of the secondary school.
Yes, correct. Teacher of Karima, Saturday Secondary.
MashaAllah. And then Dr. Adnan as well.
Assalamu alaikum. So I'm Dr. Adnan, so I'm a local GP. Been practicing as a GP since 2011. So health inequalities, again, very close to my heart, considering the type of people that I come across in my role from complete opposite spectrums. So very grateful that you've invited me onto this podcast.
Jazakallah. Well, very grateful for your time, inshallah. So, and again, I think so. The intention is just to have that discussion. So with the podcast, we're very, very keen actually just to raise the level of conversation and the level of discussion, and that will hopefully help us to understand a little bit more about the different challenges, lots of things, personal experiences that people have. And I'm sure that there's going to be lots of opportunity for that today. So, Bilal, do you want to kick us off with this Marmot report then? And so any particular findings and interests that we have from that? And again, it's incredibly important. I mentioned just what's happening globally. In my mind, I was actually sort of thinking about the protest movement that's currently happening. But obviously, that's almost sort of playing second fiddle to a global pandemic, which is kind of crazy, but the global pandemic is something that's incredibly important as well.
Exactly, and we'll go on to talk about it, but I was listening to a lecture by Professor Marmot, so just to give a bit of background about health inequalities, in 2010, Professor Michael Marmot, who was commissioned by the British government to do research on health inequalities, solutions to those health inequalities, and his key messages were to reduce the steepness of the social gradient of health. There's no discussion about whether it exists or not. It does exist, and it needs to be reduced. And it needs to be tackled with the intensity depending on how high the level of disadvantage is. So in areas that have the greatest proportion of disadvantaged people, that area requires the most intense work. The second key finding was that reducing health inequalities is based on 6 objectives. So I'll just run through those quickly.
Before you do that,
Yeah.
let me just, I think it's probably worth just eking out actually what a health inequality, what does it actually mean?
Yeah.
What are health inequalities? Like how do they affect the average person?
Mm-hmm. So the systematic differences in the health status of different populations. So what I mean by that is these health inequalities come about due to social determinants of health. So, for example, now I have a little diagram where I'll share my screen with you guys just to
See, now you're going to get all techie and I'm going to have to work it out. Go on.
So make my screen the biggest if you can.
Yep.
Yeah.
Yep.
So can you guys see, we have 2 areas here. What health inequalities mean is, for example, the biggest figure is the difference between the life expectancy of somebody who is born and grows up in Oak Ridge and Carsfield compared to somebody that is born and grows up in an area like Holmer Green. So we have child poverty index. So child development at age 5, you could see where my mouse is. GCSE achievements, they're in the red. They're compared to areas like Holmer Green, where you can see it's in the green. So in areas like Castlefield, these indicators of health are worse than their more affluent neighborhood counterparts. So death from circulatory diseases, death from coronary heart disease is greater in these areas. So those are health inequalities, and they come about based on social determinants of health. And social determinants of health are the different conditions that people are born in, they live in, and they find. Yeah, I'm back again. And yeah. So my point was that Professor Marmer acknowledged that these health inequalities are there, and how do we tackle them? How do we make sure that the changes that we make are feasible and we can actually work on them? And he came to a conclusion that there are 6 policy objectives. I'll quickly run through them. Giving every child the best start in life. Enable all children, young people, and adults to maximize their capabilities and have control over their lives. Create fair employment and good work for all. Ensure healthy standards of living for all. Create and develop healthy and sustainable places and communities. Strengthen the role and impact of ill health prevention. And our esteemed guests here today all work in different professions, but they can make great strides in these 6 policy objective areas. The 2 I mentioned here are at the national policy level, so we can't really make a difference there, but we can have that conversation. So I think I'll stop there for now. But I did want to touch up on what Asim you mentioned about the rights, etc. Professor Marmer actually makes a point of this. He used to cycle from Tottenham to where he lives, I think was in Kensington or Chelsea area, and he said that there's a difference in life expectancy of 20 years on his cycling route. And as you know, Tottenham in 2011 was the area where the riots happened.
Started,
yeah. Sorry.
Yeah.
So, and he mentions that in that riot, 90% of the young people that were arrested, they were not in employment, education, or training, compared to the national figure, which was of 11%. And he goes on to talk about the systemic differences in which people grow up. But that is what I find most fascinating. Why is there a difference of 20 years between health, life expectancy in one cycling route? And I don't know, Dr. Adnan, would you be able to comment on that?
So I worked in a place called Lane End for a few years. I don't know if you guys are aware of Lane End, but it's a very it's an interesting village. So there are three categories of people living there. There's people who have lived there for years and years and years, who I class or say is they're asset rich and cash poor. Okay, so they live in these massive houses, and they haven't got much money, so their house is actually quite dilapidated. Then you've got people who have moved to the area because it's a very beautiful village, very beautiful area. So come out from London, for instance, and they're quite affluent. And then you've actually got quite a deprived area, which is the council estate. And I came across in one clinic 2 patients, literally born days apart. One who about 65 years old, both females, literally days apart. One living on the council estate, one living in a very nice part of Lane End. Literally just roads apart. So we're not even talking Homer Green to Castlefield is actually quite a significant difference. There's a few miles there. We're talking roads. And you look at the lady from the nicer area, the affluent area, extremely looked after herself, literally got no medical problems. 65-year-old looks like a 50-year-old, for instance. And the 65-year-old from the council estate has got all these chronic health issues and is actually looking like she's about 80. And actually, it comes down to, for me, that came down to not just, is it about where you live? Because actually these people are living in Lane End, they've got the same access to the same schools, they've got the same nurseries, etc. But what does it come down to? And I think for me, it came down to actually, Brother Asim touched on this earlier when we were just doing our intros, was about aspirations and about expectations of what we can personally achieve. And I think sometimes what happens is that we get stuck in this kind of mindset that actually, you know what, this is all we can ever achieve in our life. And therefore, this is the best we're going to get. The fact that, I'm living on this council estate or in this area means that that's it. I've got no possibility of ever trying to improve myself or having those opportunities. Therefore, I'll just accept what I've got and I'll just crack on and just keep what I've got in my own little thing. I think it kind of comes down to that. I don't think it's there's a lot of nuances. I think there's a lot of cultural things come into it as well, in terms of how people see themselves and that whether their mindsets are large enough, or growth mindsets. I think it's a really good term, to actually think, I can actually do better, or to even be told that actually you could do better.
But can I just ask one thing on that point though? So what's really interesting, and to be honest, that I think it really that really resonates with me actually, because there's a number of things that I can sort of similar examples as well that I can give. But when you talk about Lane End, you're not talking about you're talking about quite a white working class or a white British community.
Yeah.
We're not even sort of talking about, we're not adding in those the other kind of factors,
the racial elements.
Race, ethnicity, religion, cultural, those kind of things as well. So it's really interesting that, again, small village like Lane End, it can be very, very different in terms of what our expectations are from life as well. And I wanted to, if I could bring Bilal in at this point as well. So Bilal, do you have that similar thing? Because one of the things that I really wanted to touch upon actually was something called the State of the Nation report. I don't know if you guys have heard of it, but State of the Nation, it's every sort of couple of years they do this report, and it is very much about social mobility, and what are the you know, what kind of level of social mobility are we at the moment? And so I can talk a little bit about my sort of professional role, and maybe again try to pick up on some of those bits and pieces as well. But one of the things that they talk about is what are the determinants for social mobility? Why is there a lack of social mobility, and what are the challenges around it? And one of those is very much about actually before children are even at primary school, it's already been done, like it's already been decided.
It's really, really
so
interesting.
you know, you as someone who works in primary schools,
Yeah.
what's kind of view on that?
So that's really, really interesting that you say that, and I totally agree. I would say that it doesn't, for me personally, it doesn't mean that change can't happen after children start school, but it is a very interesting point to make. And I give myself as an example, first of all, that when I was growing up, I did grow up, so I grew up in Castlefield, and I grew up with a family who always told me, so for example, my grandfather, who lived his whole life in Pakistan, ran a pharmacy for many, many years, and then became a teacher who taught English as well. And this is something that I was taught to be very proud of. And then at the next generation down, talking about my parents and their brothers and sisters, from them, only one of, so my mum's brother, one of her brothers, went to university at a time where it was very, very strange for people to go to university of the background that we are. But then I remember even when I started my primary school education, I would go home and I'd go to my grandparents' house, and the first thing I would get from granddad is a maths test, kind of thing. And and at the time I hated them. I used to dread going and kind of being tested in such a way. But I understood that I was brought up with the foundations of education is really, really important. And you've got these examples of people around you who have been able to do these kind of things. So don't think that you can't do them and you can't achieve them, and achieve more even. And I think that was really, really important for me in my upbringing. I do think that it doesn't just sit with your family. First and foremost, I do think that parents play a huge part in it. But I do also think that your friends around you, the community around you at such a young age as well, is a really, really important, has an important part to play as well. So I would definitely agree with that.
So what you guys have been touching on is essentially giving every child the best start in life. And I think one of the bits of research that was done in the Marmot Review was about intelligent children, or children that were in the upper percentiles of whatever metric that they used to measure intelligence, was that they found that children that were smart or born into low socioeconomic households, they regressed to the mean. So as they grew older, they regressed down, whereas children that were in the lower percentiles of, again, that metric that they used to measure cognitive score, they regressed up towards the mean. So one of the quips that the professor made was, if you're smart and poor, being smart is not good enough. The being poor takes over. If you're rich and dumb, just hang in there, it'll come good. So I think, Bilal, you touched on these issues of how we need to empower the young people and let them know that they can better their status in life. But do you find that what the professor said in his report, that comes true? Do you have any experience with children that come from families that are more working class or from less privileged households?
I would say, yeah, definitely. First of all, I would say, so an example that I always talk about with the youngsters at the youth club, that kind of sits well with them, is a famous rapper named Akala. So he's a rapper, but he's also kind of very much associated with education. He's done a few talks with in Oxford as well. Was it Cambridge? I don't know if you guys know.
Oxford Union, yeah.
Oxford Union, that's right. And he came from one of these kind of communities that we're talking about that was very deprived. He was one of the top kind of 2 or 3% in terms of education wise. He was very, very smart growing up in school. And although he talks about it quite openly and says that he may not have got all of the opportunities and he may not have had the surroundings that were kind of perfect, if you like, for his upbringing, but he remembers key teachers that he had that paved the way for him and gave him things to think about for himself as well, that helped him to kind of make the journey that he essentially did. And for me, there's numerous examples of children that we come across. And I would say, personally, I would also focus on children who have special educational needs, for example, and children who are from a PP background, so pupil premium, children who come from a background where families are on a lower income than perhaps the average income. And I would say one of the main things for them is not actually knowing what they have access to. I feel personally that's a huge thing, because honestly, there is a lot available out there, and there is a lot of good work going on in schools and in communities for sure. So for me, it is making sure that they know what is accessible. Example, so at the moment, with the virus that's going on at the moment, a lot of schools are shut to most students, apart from the students who have come from backgrounds where parents are key workers. However, children who come from backgrounds where financially they're kind of not earning as much, their families, as others, they do have access to schools. Children from special educational needs background also do have access to schools as well. And again, it is the final decision lays with parents if they want to send them in or not. But even if parents choose to not send their children into schools, they can get further assistance. So for example, I myself, I will have regular contact with specific children from specific backgrounds, special educational needs students. I will make a phone call home at least once a week to make sure everything's okay. And on top of that, the work that we're sending home. So for my school, we have an online platform that all the children go on to and submit their work. Different schools do things in different ways. But for us, there are children who are not used to technology at home, and some children from particular backgrounds who might not have many electricals at home. They might not have a computer at home. They might not have the latest iPad at home, that kind of thing. So they don't have access to these facilities. So what happens? Get in touch with your school, because your teachers are available and they will go out of their way to print off the resources that a child needs, and they will send that home. So that's just a few examples of things that I feel that it's really, really important to reach out to schools, talk to them about your individual situation and any kind of restraints that you've got, and inshallah they will be able to assist.
Can I just ask about, though, so you work in a primary school in Buckinghamshire, and just to go back to the point that Iblal made from the report, that if there are children with sort of higher cognitive ability but they're poor, they may well struggle. Well, not struggle, but that they will regress back to the mean. And with those children that don't have as high cognitive score, but they are from slightly wealthier families, they'll sort of progress up to the mean. And that, for me, that kind of quickly resonates with things like the 11 plus in the Bucks system.
Mm-hmm.
Like that, how and how do you see that sort of playing out? I mean, both in the secondary school, supplementary school setting, and in your professional setting in a primary school.
So it's interesting. Again, I'm glad you actually pointed out about the supplementary school, because even within supplementary schools, you do see the differences as well. I feel the differences that I've seen from, for example, when we have students in school as well, who are from an affluent background, even as teachers, I feel that you can tell very early on in the academic year. And a lot of it is about the experiences that those children have had at home before they've even come into the school. So particular subjects that we might speak about. children have already learnt about those things. Children might have certain kind of books like encyclopedias at home that they've looked into. From an affluent background, children might have gone on particular holidays and learnt about different people, different cultures, different beliefs. So when they are presented with this kind of information at school, they've already had a little bit of a head start in different areas. And I think that's the area that I do see the most difference in. It's the experiences that children have had before they've even walked through the classroom door.
Cultural capital.
Exactly that.
Yeah.
I'll just come on that actually.
Yeah.
You mentioned cultural capital, so there's also something called human capital. But actually, you know what? I just want to take a step back. There are two things. One is regressing to the mean if you are below or above. You know, what are the reasons for that happening? One of them definitely is experience. However, I don't think just to say being affluent, obviously in the majority of cases, the more affluent somebody is, I suppose they will go upwards. But actually, you mentioned encyclopedia. You can see behind me on my left-hand side, that encyclopedia is from 1989 or something like that. Okay, so, and you know, I think we all share very similar stories.
Pre-Google.
Definitely pre-Google. My son's like, what is that? Why have you got that? But actually, there's a story behind that. And actually, so we all come from working class backgrounds. So my dad was a bus driver. He's retired now. But he had, so I don't think, if he'd left me to my own devices, there's absolutely no way I'd have ever become a doctor, I don't think. I don't think I would ever pass my 12+. I'd probably, I don't know what I'd be doing. But anyways, so he's the one who pushed all of us. So he knew that that the only way to actually, you know, to move up that social ladder or whatever it is through education. He did not want us doing hard labor. He was a mechanic as well. He did not want us. He'd come home and he goes, right, do you want hands, black hands like mine, covered in oil, or what do you want? And that's the way he kind of that's the way he changed our mindset from being just stuck in this kind of like, you know, this is it, you know, my dad's a bus driver, a mechanic, therefore I can only ever be a bus driver or a mechanic. And actually there's that mobility there. So he actually bought us that encyclopedia when we were little. And I'll never ever get rid of it because it's more. I can't remember the last time I actually opened it, but there's sentimental value to it in terms of the fact that actually he had that vision to do that. So it's like, how do we? So it goes back to parents as well. How do we, as a community, not only try those kids who have actually got into primary school or into secondary school, and they're now doing really well and going off to university, how do we help those kids? But also, how do we instill into parents' minds that you don't have to accept the fact that just because you can't speak English, just because you never went to university, just because you've always done, you know, whatever type of work, you know, your kids can definitely go on and do that. And they don't have to become doctors and engineers and lawyers and dentists. There's a million and one other things they could be doing. How do we take those steps? Because I think if you look at the Marmot Review, so that those objectives are listed in order of priority. And the first objective is giving every child the best start in life. I think absolutely that is the key. If you don't get that right, then there's no point. We can do all the health kind of policies, etc. I can try and make sure that you know, we have you know, equal access to healthcare, etc. But that will only help for people who are around now. But actually, these kids who are growing up in 20, 30 years' time, they'll be still stuck in that rut. So unless we change that childhood issue, the rest of it will help a little bit, but it's not going to make any difference.
And I was going to say, one of the things that's really interesting from the State of the Nation report, I think it was like 2019 or something, 2018, 2019, is that although there is policy, that policy is actually not reaching those children that need it the most.
Yeah.
And so that's incredibly important for us to remember that. And again, I think from my thing, you know, one of the other podcasts, we do discuss this actually, where does the local, where is there a local importance and where is there a community need to get in there, literally grassroots, get them, get people involved, mobilize people, organize people, all that kind of stuff, versus policy review that sort of comes top down, and then that affects, that hopefully that affects that kind of change. Is actually where is that balance? But for me, that was really interesting to read. Actually, I remember sort of reading and thinking, oh, actually, hold on, what's the point of all this policy if it's not even actually affecting change where it's supposed to affect change?
And Moods, you mentioned that, and I actually had some notes on it. For one of the solutions that the report actually makes is to support families through parenting programs, children's centers, develop key and send out key workers who need to meet social needs via reaching out to families. And interestingly enough, I was just thinking that, the supplementary school that Bilal, mashallah, is the head teacher of, that is one of the recommendations. And this has been going on even before the Marmot Review took place in 2010. So there were those well-intentioned people that, started something like Karima 20 odd years ago that would give our children from our communities that extra help on the weekdays or extra help through Saturday schools, and where parents, whether or not they spoke English, could go there and at least have a conversation with somebody who was in some sort of position of authority that would be able to help them.
And the thing is, just to say as well, we're having this discussion, and I think it's really important, as I mentioned earlier, is that we have those discussions and just eke out some challenges, some difficulties, but actually part of the discussion is always about solutions as well. So bear in mind that I will be, towards the end of the podcast, asking you guys, what are your, maybe like a 2-point plan or a 3-point plan for like what other kind of solutions. But just very quickly as well, to just touch upon that point, Bilal, is that Bilal mentioned Akala as well. So one of the things Akala mentions actually was very important to his, I suppose, his upbringing, was that he went to a Pan-African supplementary school. And that's incredibly important for him in his sort of growing up and nurturing. And then one of the things we're finding now, especially with kind of uprising and race challenges, especially in the UK, is that those people from Black minority ethnic groups are sort of saying to schools, we'd really like for our children and all children to be taught about empire and British Empire and all those kind of things. So what is our history? What is that kind of, and again, that for me, that does lead to that whole thing about cultural capital as well. And I think that's incredibly important.
That's really interesting you mentioned that, because part of my role in my school is to also train up trainee teachers in South Bucks. And one of the training programs that I run is on British values, which has been a really, really big thing in the last few years. And while I'm teaching it, one of the questions that I ask all of the trainees, and there's about 35 trainees in the room, I say to them, when did the UK abolish slavery? And they all just look at you like, huh? And it's not that, they're bad or anything like that. It's a case of, I don't think we give enough emphasis these kind of things in our curriculums. I mean, even I think it was worse in America. And even if you ask people that when was it abolished in America, because it was later in America that it was abolished, we actually started that process first. But people just don't know. But if you ask them, what period was Hitler around, and when did we kind of, good prevail over evil kind of thing? People seem to know a lot more about that. And I feel we do have to kind of widen the amount of kind of history and think more carefully about the things that we're teaching.
I think one of the incredibly interesting things around this lockdown situation has been parents who have had to then teach their children. And sort of me being one of those, and I thought it was really, really fascinating. Actually, one of the very first discussions that I had with my son was about we had the curriculum that was sent in from school. So he has his English, he has his maths, blah blah blah, and they have something called Topic. And I was like, okay, what's this? So I clicked on Topic, and he said it's almost PSHE type thing. But that topic was, and they're learning, they're learning English comprehension, language, all those kind of things through Topic. So his topic was India. And I was like, oh, okay, let me read. So, and it was just, you know, it's just basic stuff. And I thought, do you know what, actually, as a parent now, I have the opportunity to say, I'm gonna teach you about India. Let me teach you what there is that needs to be taught about, you know, this colonialism and imperial, you know, this period of imperialism. And I think I think he just went over his head, but you know, I made the effort.
Yeah.
I think we have to be careful as professionals as well. I remember going on to a website that's really, really famous actually for providing resources to teachers. And I remember when we were talking about Thanksgiving to the children that's celebrated in America. And one of the resources that was provided talked about how many, many years back when the Irish went over, you know, the British Empire, when we went over to America, and everybody was nice, and we got on with the people who were there, and everybody had a party and shared food, that kind of thing. And I was just looking at it like, hey, I'm not teaching my kids this. But again, I think it's about, we just have to be very, very careful where we are getting our resources from as well.
I think history is definitely a really important point you make. So if I can just touch on us as a Muslim community, and again coming back to that growth mindset, aspirations, etc. We don't, you know, we're not looking around and all we're seeing is Islam or Muslims in this time frame, and even then we don't see real academics. We don't see, you know, a Bill Gates version. We don't see a Steve Jobs. We don't see those kind of people who are Muslims. But actually, you just have to look back, you know, 100, 200, 300 years, and you see, especially, I think things like Ertugrul are really good. I think that's going to be a really good, it'd be useful to talk about that at some point as well. But is the fact that actually we have got so many amazing role models in our history who were the best at what they did. And that is actually what we should be aspiring to do anyway. We should be aspiring to be the best at whatever we do. And how do we now take that from our history? How do we find those role models and say, look, just because we're in this current situation of about 100, 150 years where things have gone very stale, but how do we actually remind people that, you know, as Muslims, we were and we should be the best people. We should be aiming to really achieve whatever maximum potential we have got, which is what always happened before. It'd be worthwhile just getting your thoughts. And I think the Ertugrul thing just popped into my mind because you look at, I don't know if you guys have watched Ertugrul, but I became completely addicted to it and watched the whole 6 series in about 6 weeks type of thing.
Oh, wow.
And there's one, not literally 6 weeks, but anyways. And there's one. There's lots of lessons. I think one of them is that the whole mission is to kind of create their own state, and they realize that a state is only created by having a good balance of all the people. And one of those people or types of people is, you know, people who can do art, who can do crafts, who can create things, who can write, who can do poetry. And it's not just about having some, you know, for want of a better word, a bunch of Maulvis just giving out a bunch of fatwas to everybody and everybody else having to get. No, that's not what Islam was. Islam was about that whole community. And how do we now bring that back in so that, you know, if somebody's great at doing art, excellent, go and become, you know, there's so much Islamic art. Why are we not pushing those things? Why is it all, why has that changed?
Yeah, and it's very important. I think like it goes on with the review again goes on to say in the second objective is to enable all children, young people, and adults to maximize their capabilities.
Yeah,
and that ties in really well, Dr. Adnan, with what you were just saying in terms of being able to empower these people or the youth and young adults to, you know, to pursue their passions. And I guess, why is that not happening, or is there some sort of, do we hold STEM subjects in higher in higher regards than humanities, for example, or the arts. But that's again, I don't know if Bilal or Asim would like to come in on that.
Let me ask a question then.
Yeah.
From you guys then, because and again, I don't know all of these. Maybe it might be worth a quick Google. But have all of you heard of Maslow's hierarchy of needs?
Yeah. So security, etc.
So Maslow's hierarchy of need is basically a pyramid. It's not an Illuminati pyramid. It's just a normal pyramid. But the need, but what you guys are talking about is the absolute pinnacle of that pyramid, which is self-actualization. So what are we? But before we get to the pinnacle, we obviously need to get all of those little bits in, at the bottom. So at the bottom, it's the basics. It's the absolute basics of security, food, shelter, those kind of things. And then we get up to the point of things like psychological well-being, psychological health, those kind of things. And then there's other things as well that will include love, social sort of friendship, and those kind of things. So I think the point that's trying to be made is actually we're not able to. What is it that's stopping people from, particularly within our community? And I think, again, one of the things that's really interesting about Carla's book Natives is he talks about obviously there's challenges around race, and he talks about all sort of the different sort of connotations, challenges, difficulties within the Black community in particular, obviously. But he talks about working class communities. And so, and for me, I think that's what it is as well. It's about working class communities, which is, as mentioned, where we're from. So where is the gap, or where is the barrier? Where do we end up stopping that stops a lot of people from getting to that point of self-actualization? I think it's probably worth me just bringing it up.
For me personally, it brings it back to what Dr. Adnan was speaking about, parenting and the way that his father taught him. For me personally, amongst many other things, I think there's two really, really important things that come into this. After all of that kind of well-being side of bringing up your children in safety, giving them love, that kind of thing, I think there's two main things that have to be considered here. Number one is aspirations, teaching your children aspirations. But then also, I personally feel very strongly that it goes hand in hand with teaching your children hard work. And I think that those two things have to go hand in hand, because, for example, if you just have aspirations, but you don't understand hard work, you've got other dangers that you can get into. And again, it's the thing of, if you do hard work, but you just keep on doing the same thing again and again, and you don't have those aspirations, there's other kind of dangers that you can get into as well. So I think those two things are really, really important to kind of feed in to children in their upbringing from a very, very early age.
So Bilal, let me ask you, you do a lot of youth work, right? From the people that you work with, do you see those aspirations and that discipline for hard work?
Some of them. I would say that they're all different, although they do kind of come from the same community. They're all, and that's an interesting thing as well, that they come from the same community, but they're all kind of different and have different levels of aspirations. So if, for example,
what are their aspirations though? Those ones that do have aspiration, what are their aspirations? Is it my aspiration is to forgive I was going to say forgive the colloquials, but man's going to ride a BM minute. Man's got to get that sick whip, yeah? Is it about that, or is it, what are the aspirations?
So to give you an example, out of, let's say, 10 youngsters who might walk into the youth club, right? I would say probably one of them will speak about university. Another two of them will probably speak about getting a job. And if kind of given a lot of support and a little bit of a push from us, might talk about getting some help with doing their CVs, kind of having that kind of a conversation. The majority of the others won't talk about any aspirations whatsoever. Doesn't mean that they don't have them. I would say that some of those probably are thinking at some point in the future, this is what I would want to do. This is the pathway that I'm thinking of going down, whether it be college or studying A levels in sixth form, and perhaps even university. They may not talk about it, but I would say that a large portion of them do have that their aspiration is, I want to drive a really nice car like the one that so and so is driving. And to be honest, so and so may not have worked a day in their lives. So and so may not be somebody who shows them aspirations and hard work. Going back to that, and that's why I say it goes back to those challenges as well that somebody mentioned earlier. That do youngsters have the opportunity to see kind of the Bill Gates, and not even if it is the Bill Gates of the Muslim community, but people who have nice cars, because Muslims do have nice cars. Hardworking Muslims who earn halal money, they do have nice cars. However, the youngsters are not seeing them, and perhaps another thing is that they're not getting their time, or it's just that those people aren't available in their everyday lives.
And it's very important to show the community people like Dr. Adnan, Bilal, you know, mashallah, guys that are teachers, that working professionals, and show you, look, you know, we're brown. Because one of my I spoke to Asim about this, I think, in the first podcast, where someone from a local school, Carsfield and Oak Ridge, went to the children and said, "What are your aspirations? What do you want to be when you grow up?" And what they said was, "I want to work for Jimmy's Pizza," or, you know, "I want to work for so and so taxi base." And he said he was shocked, he was stunned, and to be honest, that took me aback. Like, why? And not to say that, you know, there's anything wrong with working working there, but is it that those children just don't see, or teenagers don't see working professionals? Is it that, you know, those aspirations just don't come into their minds just based on, for example, you see your own father as a role model, but their father, for example, is working at, you know, in a taxi base or working at Jimmy's Pizza, for example, but they don't come across Asians that are working in positions like as a GP or as a teacher, or, you know, it could be any profession really.
One of the things that I have in my role, in my professional role, is it's basically widening participation for students to go on to university, higher education. One of the things that we have is, so we actually use a lot of data in my particular job, and it's a lot of indices of multiple deprivation. We use data from there. We use data from something called Polar, which is participation rates for local communities, etc. So there's a lot of data and stuff that goes on there. One of those is data, socioeconomic data, and where the students are from. When I very first started the role, actually, I had a very interesting conversation with someone who said, "Look, you've got student A and student B, and what you're doing is they're both on zero. They're both on zero. They both get good SATs levels, so they're both now on 1. So they both got a point. And then now they both get good, you know, whatever. So they're doing well academically, so they both get another point. Because the difference is that student A, for example, mum is housewife, dad is manual labor role. Okay, that's fine. Uncle is manual labor job. Uncle's a taxi driver. But auntie works, I don't know, reception somewhere, or a cleaner somewhere. So mum's friend is also a housewife. Friend's mum is also a house. So that's the kind of limit, and that's the kind of limit to knowledge. Whereas student B, dad's an accountant, and mum is a lawyer. They go away on holiday to the Alps and they go skiing with mum and dad's friends, and mum and dad's friends, dad's friend's a vet, and then mum's friend is a GP, and dad's friend is, you know, he's a CEO of a company, and, you know, and then so they already have that. And then so when they have the opportunity to go on to, when they're a little bit older and they go to work experience, dad's friend says, "Listen, can my son come to your, you know, veterinary clinic and work experience there, or can they come to you?" So again, it's just about that cultural capital really does hit in, and it just, children already know. They know a police officer, they know teachers, they know doctors, they know nurses, they know all of those kind of professions. They're quite normal professions. But all the other extras, that's kind of where we really do need to think about cultural capital as well. And again, talking about aspirations, one of the other things I wanted to very quickly mention about aspirations, when Doctor mentioned it, was in my particular role, I won't mention the area, but it's near High Wycombe. I went into, it's a youth club, so I went into the youth club, and I was just taken aback straight away. You kind of walk into, and I'm not sure, Bilal, how many other youth clubs you've been to apart from the one up in Castlefield. But again, in a very previous role, I used to go to loads of different youth clubs. But this youth club, I walked in and I was like, wow, you had pictures from the 80s. You had those massive headphones, big DJ decks. You had shell suits. You had mullets. You had all of that kind of stuff. So there's a huge amount, and it's just like 40 years worth of pictures on the wall. And when I spoke to the lady who's the head youth worker there, she said that she's been there for 30 odd years. She knows like grandparents of the children that come in now. And then she said she gave me one example of a girl who was very, very academic, very, very smart. Just for some people, mashallah, Allah's blessed them. It's very easy for them. So she would literally go in, it's all good, it's all easy. And then she spoke to us like, what's your plans? Where are you going to go to university? What are you going to do? And she said, you know what? Mum didn't go to university. My grandparents didn't go to university. My brother didn't go. My uncles didn't go. My siblings didn't go. My friends aren't going. So why am I going to go? Like, why am I going to? And it's just about that fear of, look, I don't even belong there. It doesn't matter how intelligent I am, but I don't belong there. And I have spoken to students who've been to Oxford. They've been to the university. They're capable of getting there. But when they walk in through that door on that first day, this is really not where I'm supposed to be. I'm not supposed to be here. I was like that when I went to university in Portsmouth. I was like, what am I doing here? I'm a brown kid from Wycombe. I'm not supposed to be here.
And Moods, exactly. Again, this is something that I mentioned to you before as well, is when I passed my 11 plus and I went to RGS, that's exactly how I felt. I was like, hold on a sec. This isn't for me. And I came from Castlefield School. I think I was the only child in my year that passed 11 plus. One other lad got through an appeal or whatever. He went to John Hampden. But again, it's so striking that a lot of these, a lot of what you mentioned there is the same that's happened to you, the same that's happened to me. I guess it's quite similar. It's quite a broad issue, I think, then, because I just thought for a long time it's just me.
But I'm asking is, what I really, really want to get to is, why is that a problem? Whose fault is that? Because ultimately we have to take some responsibility, right? Because when I told years later, I told my manager, and she was like, that's your problem. And I was like, that's not my problem. Like, I was only, and she's like, actually, and I think within our communities, we do have to ask that very, very difficult question of, actually, what are we doing to try and tackle these challenges? Because otherwise, all we're doing is we're talking about it and we're going, Blair didn't do this, Cameron didn't do this, Boris is this, that and the other, whoever. We could talk about all of these policies, we could talk about left, we could talk about right, we could talk about Labour, Conservative, whoever, but ultimately, what are we doing within our communities? Because otherwise we're just constantly blaming someone else.
If we take me, for example, right, and you guys can assess this and see if we can come up with something here. So I studied at Holmer Green. And then after my GCSEs, I got the grade to go to John Hampden, the local grammar school. Really felt out of place there, felt like I didn't belong, all of the things that you've just been speaking about. Then I went to university. I went to Kingston University, and I studied a subject that I thought, yeah, sounds good. It failed, right? And then what happened is I studied another subject that I thought, oh, this is a good subject and I think it'll make me good money. I'll go and study that. Failed again. I failed 2 years in a row at university. Then I took a year out and started working full time. Then I think a lot of it was my mum and dad continuously saying to me, look, you can do it, you can do it. And I went back, it was only the third time I went back to university, and after I'd really thought about what I am good at, not about what makes me the most money or what the popular thing is to do. It was about what interested me. And when I studied that, I loved going to my lectures. And it was after that that I studied, so I studied criminology and politics at university. And it was really, really interesting. Criminology, always loved kind of learning about that. And when I got there, I loved it even more because they'd put kind of movies on like Godfather and Scarface and kind of pull them apart and work out why people do things the way that they do them, kind of psychology of crime. That was my kind of journey getting to university and getting through it. And for me personally, looking back at it, the main thing that comes back to me is my parents. Mum and dad always pushed, you can do it, you can do it. But perhaps not in the forefront, but if I think about it deeper, maybe it was also the people that I had around me. Mum and dad always made sure that I had good role models around me, aunties and uncles, cousins, always promoting that you can do it. You know, education is the way forward, that kind of thing.
So can I just comment? So
Yeah.
we all agree that actually, you know, I think the Marmot review, you know, it's common sense really. I think what he's come up with, and key absolutely is children, and we all agree that parents are key to kind of promoting this idea on this growth mindset. The problem is, how, if you don't have, Bilal, you know, you're very lucky, you have supportive uncles, aunts, parents, etc. Alhamdulillah, you know, I had a, you know, very supportive father who had, and actually he wanted us to become doctors. There's a personal story behind that. I had a younger sister who was in hospital and all those kind of things that triggered those mindsets. But also, we were very fortunate. You know, my dad's very good friends. In fact, his best friend, you know, is a solicitor. Then he's got friends who are account. You know, they had that kind of background. They had those influences. So we were very fortunate, I think, in terms. Although we were definitely not affluent, very much working class, but we had those opportunities of how to grow. But those people who don't have access to that, those people whose uncles, aunts, parents are just working in those, you know, kind of very much labor type jobs. How do you get those kids to kind of think, you know what, I can actually go off to university, I can actually become X, Y, and Z, or, you know, how do you actually do that? And then the second thing I just want to quickly touch on. So my son is now RGS as well, and the ethos has changed at RGS. I think they've got some good teachers in there who are now actually thinking, you know what? So schooling and university has always been about, let's drill education into these kids so they come out of university and do some kind of job, and that's what they're going to go on to do. And you basically get rid of all creativity from that child. You stop them from making mistakes because they're just passing exams, they want to get A stars, etc. And that's all the target is. So you're getting rid of creativity. So for instance, you know, if you had 10 4-year-olds and you asked them to sing a song, they'd be more than happy to sing the song. But if you've got, you know, 10 20-year-olds, told them to sing a song, you know, they'd be extremely shy. Why is that? Why is that changing? Why are we getting rid of creativity? And I think those two things, so allowing children to really develop and take what they want to do, what is their passion, and then also how do we also, open up their minds, open up their eyes and say, you know what, you love, I don't know, you're a great mechanic, you're really good with, you know, taking things apart and whatnot. That doesn't mean you need to be a car mechanic. Actually, you know, being a car mechanic, you could go and work for Formula One teams. You can go and work for an F1 team. You don't have to be working at a local car garage. What are those aspirations? We're not talking just, you know, completely academic, but actually there's a lot of academia in Formula One.
Mm-hmm.
I think again, it's from my point of view that I know that a lot of Asians hold STEM subjects in a lot higher regards than, for example, the arts and humanities, and sometimes I find that in the STEM subjects there is it's quite intense, and in that you're continuously studying, you are always made to sit these exams, to pass the exams and get the best grades possible, and there is some sort of lack of creativity that comes about as a result of the continuous cycle of this exam 11 plus, then a year, I don't know, 8 SATs or your 9 SATs, then GCSEs, then A levels, then you do your uni exams, and I guess there's just not that time for children to be children, or for adolescents to be adolescents. Again, I remember Moods Asim touched on this before, where he said, or that a child in year 11 who failed his 11 plus was distraught, thinking that his future had gone down the drain. And I think, again, it comes back to being able to empower the future young generations to say, hang on a second, let's contextualize this. You know, we've been through what you've been through. This is what is going to happen. You know, and it doesn't mean it's all doom and gloom, because someone who's not from an educated background, for example, a parent that's an immigrant, will see the 11 plus and say to their child, look, this is your future, this is make or break for you. And in some senses, you can understand where the parents coming from, because they don't necessarily know better. But at the same time, we have to be able to say that, you know, there have been people that have gone on to schools like Crescix, or, you know, schools that aren't grammar schools, and they've become successful in life. And just touching on one of these points, Asim, where you said you're going to ask for solutions, I think the fella that told me about these, the children that wanted to grow up and go to Jimmy's Pizza, etc., one of the governors of the school actually said that we should hold a careers fair with Black and minority ethnic professionals, so these children can see that, oh, actually, look, you know, there's a doctor here, or what does I don't know, a pharmacist do, or what does a teacher do, or things like that. So I guess that's always something that we can bear in mind, and hopefully look to, if a need is there, then we can always look to fill it. Alhamdulillah, we've got a network of working professionals that will look into better give back to the community, and, you know, we can try and use that.
That was certainly one of the intentions, actually, we'd already discussed with Bilal, about the secondary supplementary school, actually, to have not necessarily a careers fair, but almost what do you call it, a speed networking thing with some of the kids, some professionals, and just have that conversation. So inshallah, once if and when this lockdown situation eases and we're able to get back to some kind of normality, whatever new normal is, I'm sure we can pick that up. But I do want to go back to that thing about taking responsibility, and I actually wanted to, so one of the things that we've obviously talked about is health inequality. Now, there may well be challenges, definitely around social challenges. There may well be challenges around, I suppose, genetic factors that allow us to, that, you know, within the particular Asian community, that, you know, that means we're predisposed to particular challenges and particular issues. But actually, I mean, I suppose, Doc, this comes back down, you know, this might be something for you, really, but do you see Pakistani Asian communities actually taking responsibility for their health, what goes in their mouths, what they're eating? Are they doing enough exercise? Do they have, you know, are they doing the right types of exercise? Are they eating the right types of things? Like, you know, again, is it that it's just like, oh my God, you know, yeah, we're Asian, and so it just means we're, you know, predisposed to diabetes, and we're much more likely to have heart disease and coronary heart challenges and issues around. And, you know, I know we smoke, but actually, you know, is there something about us actually taking some responsibility for those things?
See, I don't think anybody sets out deliberately to harm their health. Okay, first of all, I don't think anybody does that. And actually, the Pakistani community, you just have to go back to Pakistan and you see how literally any minor illness, they're down to the pharmacy, they're down to the doctor, they are accessing healthcare. The problem that we see or we have is that actually it's the lack of understanding of what healthcare they need and when they need it, and then what to do with it when they get it. So for instance, diabetes, huge issue. Now, a lot of people, and obviously it's extremely prevalent in the Asian community. One of the issues we face is that it's too late. It's almost too late. When they get diagnosed, it is too late for them, because actually they have, because obviously this is something that's been building up over many, many years. They could have done something at some point, but now it's too late. And then at that point, they're now in that catch-up mode. So either they are trying to control their diabetes through diet or medication. There's a lot of fear due to misunderstanding. I don't want to go on to insulin because I know insulin causes X, Y, and Z problems, but actually that might be the best treatment for them. So it comes down to, I don't think it's the fact that they don't want to be healthy or they don't want to access healthcare. I think it comes down to a lack of understanding. And this is part of my role, is I really try going out there and trying to explain to people that, and trying to get rid of that fear. One of the things we're facing at the moment, issues, is coronavirus. There's a massive fear around that as well. And it's a fear of treatment. So with diabetes as an example, people are scared of having insulin injections because usually insulin tends to be one of your, in fact, historically, insulin was a kind of last line treatment. So you did all the medication stuff and the X, Y, and Z, and then you went on to insulin. And then obviously that was later on in life. And then people tend to unfortunately get worse and they die because they get all the other complications. And that then became this kind of, became associated with being started on insulin. But actually, things have changed now. Insulin is being used probably far earlier. There's injectable treatments, but those kind of fears are still there. So for me, it's about how do we educate people in their own language, not only once you get an illness, this is the best way of managing it, and actually listening to your doctor, but also how do we now take a step back so people 10 years, 20 years before they're going to get diabetes or heart problems, how do we promote good health at that point? I think that's the thing that's missing in our health, in our community, is that we don't do much health promotion. We do treatments, which is actually, it's a bit late then, and there's so much more we could be doing in health promotion, which people don't really take seriously. That's the bit that we need to be focusing on.
And I was going to say, though, so it's almost that prevention is better than cure mantra. But when you say people don't take it seriously, and that almost makes me sort of think, actually, hold on, like how many times do you need to tell people, look, you can't have jalebi for breakfast? Like that's just not a thing. But you shouldn't be doing that. Like that's, and that is the thing about people taking responsibility, isn't it?
So it's the understanding. So what's wrong with having jalebi? It tastes lovely, obviously don't have breakfast. But the issue with it is actually there's nothing wrong with eating jalebi. There's nothing wrong with eating any kind of sweet food. The problem is that we eat too much of it, and then genetically we're not, in the way we are living in this country, and in fact even living in Pakistan or any Asian country now, because of our lifestyle, we do not burn off those carbohydrates in the same way as our grandparents, and actually just have to go a few generations back, working the lands, farming. They'd be having shed loads of carbohydrates every single day. They didn't get any heart problems or diabetes because they were burning them off. But actually, genetically, we are made so that that kind of so Asian people tend to put weight on around their central area, around their belly, for instance, because that's the quickest place to actually then get that turn that fat into sugar stores, and there's this kind of genetic predisposition that actually, because we're not sure if we're going to get a meal tomorrow, that if I have excess carbohydrates today, I'm going to store that so that tomorrow I'm not going to go hungry. But actually, because we are still eating and we're not actually burning off, you end up putting all that weight on. So it's about how do we get people to understand, this is just talking about diabetes, how do we get them to understand that actually it's not about the delivery, it's about the carbohydrates, it's about what you're eating, it's about how it's then going into your body, how it's being stored, and then how it's being utilized. You just have to change a couple of things, still eat all the food that you want to eat, but you just have to do something different. It's getting that out, it's getting that understanding out. And it's people still, even with diabetes now, they just don't understand these concepts. They understand they've got a problem with sugar, and they look at sugar that they put into their tea and, oh yeah, I've cut all sugar out. But then you look at their diet and they're having all these carbohydrates through their roti and jawal and all those kinds. They don't understand it. So for me, it comes down to, it is about how do we get people to understand the fact that actually these illnesses, in a way that makes sense to them.
So
You know what the other thing is? Sorry, go on.
how Dr. Now, would you tackle that? For example, do you think leaflets in the Urdu language? Do you think Urdu, a doctor who's proficient in Urdu giving some sort of, I don't know, talks on YouTube? What do you think?
Right. So I've actually thought about this, and I think leaflets are, who people don't tend to, if they read them, first of all, they've got to have a decent level of understanding of Urdu, and you can't really read Punjabi anyway. So you've got to have a decent level of education to actually understand those words. Somebody who's really good at speaking Urdu, when they start using their really complicated terms, it's like, whoa, that just goes over my head. I need somebody who can just tell me in pure, simple terms. And the best way, I think, is going to be, so this is a small project, and actually maybe it's something we could do here, is actually getting those people who've been through these illnesses or who've actually managed to change themselves. But you tell me, what is it you did about your diabetes in your language, in your words? How did you understand it? And what actually changes did you make that impacted your life? Then hopefully that, I think, personally, I think that's probably the best way to get somebody to understand, when they can hear it from, it's like talking to your mates and they say, oh, I tried this thing, I tried that thing. If we can get people like those in those kind of conversations, that could have impact.
I was going to say, but it's also about that language around that science of, okay, because it's sugar, carbohydrates turning into glucose, and then what the process is there, and there's diabetic, there's pre-diabetic, what are the challenges? And I think this is just an incredible amount of misinformation. But are we, and I think that's, for me, that's the thing, is actually how many times do we need to tell people you've just got to be incredibly careful, and then you've got to up your exercise as well.
But it also comes down to what alternatives we give to people. So if I tell somebody, stop eating roti, okay, and this guy, and that applies to me as well. Since I have roti every single day, I've had it since I was a little baby. You're telling me to cut something out that is part of my life. This is part of me. How can I can't give that up. So you got to give me either an alternative, or tell me in a way that I can still incorporate that into my life, so I'm not missing out on it, but actually then I can do something that counteracts the effects of that. So what we do as doctors typically is, right, you need to cut this out, you need to cut this out, you need to stop drinking this, you need to stop eating this, you need to start walking 30 minutes per day. And the guy's like, whoa, where do I start? Where, and actually, if you look at our food, it's very spicy. There's a lot of taste to it. You start taking all those salons and all those things out of somebody's life, it's a very, they can't cope. They'll do it for a week or 2 weeks. We all try it and we'll go back to it, but it's because we're not actually giving them the tools with the alternatives, or saying, how could you do it slightly differently, but actually have that same enjoyment.
So, Doc, just in case people are watching, and what you've said has resonated obviously with me, because I have my mum at home who I've tried to say, look, instead of eating roti, let's try fish today, and stick the fish in the oven, and no, this is the worst thing that you've ever made me eat. But what, for example, instead of roti, what do you think could be an alternative? Is it using brown flour instead of white flour? Is it getting rid of roti and using tortilla wraps, or what would you suggest?
Unfortunately, those are the answers I do not have. Those answers have to come from those people who managed to get around this themselves. So either they have changed the type of flour, or somebody who normally eats 2 chapatis, 2 rotis, has cut down to 1. Okay, you're still enjoying it. You're just having more salan or whatever it is, and less of the roti. It's about, but you still get to enjoy what you're eating. I was really surprised. My son's a type 1 diabetic and got diagnosed about a year ago. And we had a dietitian and diabetes nurse came to our house and to do some sort of training on carbohydrates and all that kind of stuff. And I was like, okay, well, I know all this anyway. But anyways, and there was an eye opener. So you can get books. So it's Carbs and Cows book. And within that, there's every type of food, and it tells you exactly how many carbohydrates are. And so what they did was they got my wife and my mum, who we all live together, to make a roti each, and they weighed it and then worked out how many carbs was in. And I was astounded, so about 50-60 grams of carbs in a normal size roti. That's a lot of carbs. If you're having 2-3 rotis, 150 grams of carbs. How do we get that information out to people? That's so, and that's, we're just talking about diabetes, and there's a whole load of other illnesses that affect the Asian community. So for me personally, it comes down to the inequality of is it understanding or education? I don't know, something along those lines of how do we make something resonate with somebody in their own language, in their own culture, but then also remember the impact. It's really easy for me to tell you to stop eating sugar, but actually, I never bake a cake, I never do this, never do that. So where do I cut the sugar out from? Well, it needs to go out of your roti, but we don't tell people how to do that.
Can I just ask then, so just very on that point about, is this something that actually is a challenge, or is a difficulty across the board, or is this just something that you feel is that in your experience is just from that Asian community?
No, I think it's across the board. So again, if you look at, so my example of these 2 patients I had in Lane End, I'm pretty much 100% sure that if I was to go and open up the fridge in both of those households, I would find completely different types of food. Whereas, the whole mantra of eat 5 fruit and vegetable per day, fruit and veg are expensive. You go and do a fruit and veg shop and it costs a lot of money. So what are people going to fill up their trolleys with? Are they going to fill them up with fruit and veg, or are they going to fill them up with all the processed stuff? So again, it comes down to how do we make it easy for people to understand what kind of foods they should be eating, and how do they then do it so that if all my life I've eaten processed type foods or whatever, so I don't really know much of a non-Asian diet, but how do I now continue those same tastes and same flavors but make them healthier? That I suppose is a challenge.
And another, just based on that, another thing that I found fascinating was the fact that in Castlefield we've got, just in the little few parades of shops that we have 2 takeaways. What you find is that there's a high concentration of takeaways in places that have a higher deprivation. Yeah. And that again compounds our issues where obesity plays a big part, and then, for example, as you mentioned, diabetes, things like that. So I think getting people to become conscious about their diet is massive, and is something that I've realized plays a more important role now in our household as I've become older. I guess it's about, as you say, having that conversation so people understand the importance of it. You don't really pay too much attention to what goes in the mouth. Yeah, and
We've just had really interesting conversations within our family. So my wife, so we live with our parents as well, or with my parents. My dad makes his own food. He's very clear about making his own food. So my mum makes her own food. My mum, and again, it's really interesting because it's word of mouth. No doctors told her, but someone, our Auntie G down the road told me that when I gun the atta and then I just make it straight away, then it means that there's less fermentation. It's basically what she's saying. There's less fermentation, there's less sugar, and there's less processing at that point, and so there's less carbs in that, is what she's effectively trying to say. And I'm like, who told you this? But it's interesting. That's her now. That's her go-to. That's what she tries to do. But I think very interesting, just on the point about areas of deprivation in Casterfield. Yes, alhamdulillah, we don't have the other issues, but I know in particular, again, when I used to be working in London, inner city London, pupil referral unit, one of the challenges we had there in particular was the proliferation of takeaways and gambling and bookies, basically, in those areas of deprivation. That just, again, it's just those challenges of constantly keeping communities struggling with those kind of difficulties. But yeah.
And I guess what I really want to kind of bring back Bilal back into the conversation as well a little bit is, forgive me, I'm just switching lanes here a little bit. Bilal, with regards to the youth work that you carry out, I know that the population that you work with can be quite challenging at times because they do participate in a lot of social ills that we have, for example. What do you think are the biggest issues facing the youth of today? Because I recently, on my road, for example, there was an issue of knife crime which happened a month or two ago, and I thought, wow, that's come so close to home, literally like 10 houses away from me. So I don't know how big of an issue it is because I am not that involved in youth clubs, for example. So I just want to hear your thoughts on that.
Personally, I would say three things. Firstly, I would say, as you mentioned, knife crime. Personally, for me, knife crime is a huge one at the moment. I remember when I was growing up, and even if you were the kind of person when I was growing up to go around having fights and things, knives were never brought into it. It was kind of have a fist fight, shake hands at the end of it, and everybody goes their own way and kind of, forgive and forget kind of thing. But we're in an age right now where it's really, really big at the moment. Second one I would say is drugs. Okay, personally, I feel we have a major issue with drugs in these communities that we've been speaking about. And it's not just kind of class B and C drugs, it's class A drugs, in more recent years, class A drugs that we have issues with as well. And the third one I would say is something that kind of is kind of partially to blame for the first two, and that is the age of the internet. We have the issue of the fact that you can kind of say to children to do something, you can put good role models in front of them, you can make sure they go to a really good school, but we're in the age where, as somebody mentioned, Google earlier on, children and youngsters, even young men we're talking about here, they can access anything they want. And this is where you could start kind of pushing it out even wider and say kind of the music industry and kind of just going on YouTube, right? And in all honesty, right, when I go on YouTube, I could spend the whole evening on YouTube. It's so addictive. You watch one video and then it recommends so many other videos that you could be watching, and kind of, even if you watch one video that might be kind of not the right thing to watch, and then you feel like you're going to go back to the ones that you should be, YouTube gives you a whole list of other ones that you could then kind of go on to. And I think we have to be really, really careful in these three areas with our youngsters.
So, Dr. Adnan, just like to bring you in on this. Have you ever had any experience with dealing with people that might have been abusing substances, whether it be class A, B, C, alcohol, for example? What advice do you think that you'd like to impart to people that might be taking these substances?
That's a very difficult question. So
Yeah.
the answer
Drugs are
obviously,
bad, kid.
yeah, well, exactly. So can I put a little different spin on this? So, so I think for us, really, the issue comes down to the adults in our communities who are either abusing drugs or abusing alcohol, and that is something that is going on. It's going on within, as within households. So as fathers, with children, that there is these issues these issues exist. And okay, so I'm not talking about the youth, but those people themselves, they need to realize that actually what they are doing, that may actually, okay, fine, they think it's only impacting themselves at that time, but it's having an impact on their household. It's having an impact on their children. It's having an impact on their relationship with their spouse and with their parents. And at some point, they need to realize that actually they have to. It's almost like it's that whole growing up mentality. When are they actually going to step up and actually develop into the person who's actually going to take responsibility? And the point I'm trying to make, I suppose, is that they should never feel that actually there are lost cause. If there's somebody who is stuck, either is addicted to alcohol or drugs, is a Muslim, the issue is they might be embarrassed about actually coming forward and wanting to talk to somebody about these things. They should not feel lost cause. There are so many people, again, you look in history, there are stories of people who are addicted to alcohol, who came off alcohol and became amazing scholars and amazing Muslims. There's hope for everybody. So that's my only message, I suppose, is that if there are people in those situations, go and see your doctor. There's so much that can be done to help you, because I'm sure they're going to bed at night time, and I don't think they like what they're doing. I don't think many drug addicts and alcoholics actually enjoy what they're doing, and especially if they're Muslims and Asian backgrounds and they've got a family, I don't think they'll enjoy it. So just don't feel that actually you're lost and there's no hope for you. Just go and see your doctor, and it's all confidential. There's nobody will ever needs to find out what problem you've had or have, but there's always going to be help for you.
I'm just going to thank you very much for that, and I think that's incredibly important that the message is out there, that there are positive, safe spaces that will and people that will be able to help and support you. So I just want to try to bring this. It's about an hour and a half now. We're going to try and bring this to a bit of a conclusion. But just to draw on some of the things that have been mentioned. So we've definitely talked about aspiration raising within adults and I think young people. It's incredibly important. I think we've talked about cultural capital, and I think that's something personally that for me has always been, or certainly for the last sort of 5 or 6 years, has been incredibly important. And that's why there are particular projects that I've been working on that have been run. So those are a couple of the things, and I think it's important to know. And I think the other thing that I'm really getting from all of you guys actually is that we all have to do work within our own community. We can't really rely on the messages that are being sort of sent from top down, from central government or local government. Is that we can all affect some kind of change locally, and then there's an opportunity for us to do that. And then also the messages, and I think the other thing that that I've really sort of taken away from from all of you guys is actually the messages that we're getting out, and how are we getting those messages out, and is there something that can be done around that? So can we just start thinking about just maybe trying to bring it to a bit of a close?
Yeah.
Let's think about solutions, because again, I think one of the things that we've been very, very keen to do, like I mentioned right at the beginning, is we're keen to have the conversations, we're keen to have the discussion, and I think there's development and there's growth in that, but there's also development. We don't want those conversations to just stop here as soon as the video ends. We want to be able to develop on that, inshallah. So, gents, solutions.
Should we go around clockwise?
So you're top right, so you go for it
Okay.
first.
So, I guess from my point of view is coming to the natural conclusion that you've just mentioned here, and funnily enough, in chapter 5 of the Marmot Review, it's about empowering people locally to tackle these issues. Professor Marmot goes out there and makes mention that look at the people in the communities that are actively tackling these initiatives, tackling these issues, and people that have people that are doing good things. Find those people, empower those people, and make it a community-led initiative, and local governments should be supporting those issues. So the words that he uses are challenging power structures to remove barriers, preventing people from participating in issues that impact their lives. So I guess giving people of expertise like Bilal and like Dr. Adnan a platform where they can talk freely about these issues is a very big achievement from my point of view. Experts will give advice, and for us that's invaluable. Not everybody has the blessed company of these esteemed individuals, and I do think that teachers are unsung heroes of today, because what a child won't learn from their parents, they'll inevitably learn from their teachers. And some of the biggest role models in my life have been some primary school teachers that I've had. So I think big props are given to them. In terms of solutions, I think these conversations need to continue. From today, we've discussed about diet, we've discussed about cultural capital. Think people that might not have ever heard of these terms before, it might now be playing on their minds, so they'll go out and research. So continuing the discussion is a big thing for me. Secondly, the individual little things that we discussed about, for example, where the careers fair, or Dr. Adnan's suggestion of people who have actively suffered from health ailments to discuss about how they tackle these issues, and putting that out there so other people can consume. I think those are very important solutions from my point of view of what's come out of today's discussion.
Inshallah, Jazakallah khair. Bilal, Bilal Aziz, you're up next.
So 3 points of advice from myself. Number 1 being, parents, please engage with the schools that your children are going to. Get to know the teachers, get to know the curriculum that's being taught. And when I say engage with the schools, don't be one of those people who only contacts the teacher when something goes wrong. Be a teacher that when you see something good going on, communicate with the school, say, oh, well done, that's really, really good to see that the school's doing this. So you're not that face that only turns up to have a nag. Because then you are going to be taken more seriously, and you have involvement in your child's education as well. Number 2, surround your children with really, really good role models. This is really, really important. And you, first and foremost, are the first role model of your children. And as was just said, teachers, huge part of the child's growing up, their life, especially primary school teachers. Make sure around them they've also got family members and friends that you allow to be around your children. Make sure you know who they are, what kind of things that they talk about, what kind of things that they hold as their own values. And lastly, just to mention the point that going back to the drugs thing, right? And this is because I do think we do have a major issue about drugs. And therefore, I would say we need to change our mentality here, because If you ask those young lads who are selling drugs or taking drugs, they would say to you, I'd never ever eat the animal that Muslims aren't allowed to eat. That's haram, bruv. No way would I go anywhere near it. Right? Why do they think that? Because they've been brought up to think that. Okay, I was brought up when I was younger. I wouldn't even say the name of the animal. It was PIG. That's what we did. Right? So I feel that parents, it is up to you now. It's up to us as well, to make sure that we're turning things back around and we're making sure that our mentality is drugs, big no, disgusting. Don't even want to hear about it. Don't even say that name in this house. That's my third piece.
Jazakallah khair, thank you.
Absolutely. So you've left me final. It's always the last one, isn't it? Who gets the tough ones? But anyways, so I've got two things. There's a really good author called Matthew Syed. I don't know if you guys have come across him, but he's written lots of books. One of them is aimed at children, and it's called "You Are Awesome." I would highly recommend every parent to read that themselves and also get their children to read that book. It's aimed at around the sort of 8, 9, 10 mark. So kind of years 5, 6, I think. And it talks about mindset, and it talks about growth mindset, and it talks about, we talked about hard work earlier. So you've got those role models, you've got somebody who is Lewis Hamilton, Formula One driver. He didn't just become a Formula One driver overnight. He put in so much hard work and effort from a young age. And if he hadn't done that and just sat around thinking, well, life isn't fair, he wouldn't have got there. So that's the first thing, is we need to get that message out that actually good things come to those who put the time and effort in, and you have to do that. Nothing comes for free. The second thing I would say, and it's more of a practical point. So one of the issues I had growing up and going into university, so I went to RGS as well, going from, and alhamdulillah, my dad had this vision. He knew I had to, part of getting into RGS is 12 plus, but after that, that was it. I was kind of left on my own now to try and navigate GCSEs and A levels and getting into university. And I didn't get the best grades at GCSE, and I had to retake a year of my A levels. But alhamdulillah, I managed to get into medical school because it just things happen. But if I'd had somebody at that stage, once I'd got into secondary school, saying, right, what is it you want to do? These are the kind of things you now, and that's what I'm doing with my kids, my nephew, my nieces, etc. I think we now need to be those individuals. We need to be stepping up and saying, right, so we've got this network of people, right, who it doesn't, you could have a careers event, or even just putting people in touch. You know what? Expressions of interest. What are the kind of 2 or 3 careers you're interested in year 8, year 7, year 6, year 5? You know what? There's 10 kids here. Let's go and put them in front of a teacher or a doctor or a nurse or an accountant or an engineer, or even, alhamdulillah, I was at a genetics event last year. There was a Muslim professor of genetics, female Muslim professor of genetics from Leeds. I was like, these are those people that we need to be putting in front of our kids, saying, look, you guys can be these professors. You guys can be these amazing top individuals in tech, in engineering, in art, etc., in architecture. We need to get those individuals, and we need to create that network, get expressions of interest, and put those kids in front of those individuals. And finally, my last point is the cultural capital thing. So we are, as kids, we never went out to restaurants. Alhamdulillah, we didn't even have any takeaways, really. I mean, that's the first takeaway only appeared in about 1995 in Wickham, what I remember. But, the whole concept of eating out and those kind of going on holidays and going camping and all that kind of stuff, we never did that. And when I went to university and even at school, those kind of exposures, you're always like, whoa, what's going on here? How do I behave? What do I do? So again, it's about how do we give those experiences to children so that when, like Brother Asim, Brother Iqbal, myself even, when we end up in those situations, we do not feel like imposters. We don't feel like outsiders. We actually feel, you know what? Been there, done that. we can actually cope, and that gives you that confidence as well.
Jazakallah khair. Thank you so much. I mean, sorry, I just ran off because I was trying to find the book, actually, the Matthew Said, You Are Amazing. I bought it for my son, and we've been through about 2 chapters now, so we're trying to go through that. And I think, yes, again, it's just about mindset, growth mindset, and developing that growth. So just to finish off on, I think if people wanted to go away and read up on a couple of different things. So we've got the Marmot report that Bilal has mentioned. One of the things that I mentioned was State of the Nation, the report as well. So again, that's incredibly interesting. There was a few other things. We talked about Akala's book, Natives. And I think that's, again, just an interesting read for people. So Jazakallah khair, gents. Thank you so much for your time. I think it was an incredible, valuable discussion. I'm hoping people will have enjoyed the discussion as well. Obviously, for people, I'm just going to do the whole, feel free to like, share, subscribe, and also people feel free to comment, down below in the comment section as well, because I think what we'll do is we can certainly pick up on people's comments, and then, there may be an opportunity for further discussion and further chat as well. Okay.
Inshallah.
Jazakallah khair. Thank you so much, gents. I'm just gonna
Thank you
so much for your time. Assalamu alaikum wa rahmatullahi wa barakatuhu.